Hey, welcome to your Pathways to Wellness. I'm Dr. Marian Constantinidis. I am a functional frequency medicine doctor, natural health advocate, and co-author of Beyond the Back. I am your trail guide on your path to wellness. I've dedicated my life to empowering people to reclaim their health by addressing root causes, not just managing the symptoms. Today, I want to discuss something really very personal and deeply concerning to me. Our current healthcare systems focus on sick care rather than true healthcare. It's a reality that becomes especially vivid when you or a loved one faces a serious illness like cancer. I found myself sitting in the oncologist's waiting room next to my husband. He's only 45 years old and was recently diagnosed with stage 4 colon cancer with metastasis to his liver. In that room, I was surrounded by adults of all ages and each one facing the battle of their lives. I watched the steady line of patients waiting to see their oncologists and others lined up to have blood drawn. There were so many patients. The clinic was especially efficient, well organized, and staffed by professionals working tirelessly for each and every patient. Yet at the same time I was admiring the staff's dedication, I couldn't shake the troubling realization that this entire operation, despite its compassion and precision, was also a business reliant on managing illness. This is what our system has become. It's a business model built around managing disease. Here was an entire floor of a high-rise building completely dedicated to exclusively working for cancer care. It had a maze of treatment bays, laboratories, exam rooms. It was super clear that every single patient there represented a life story, but also, frankly, revenue from a business standpoint. And as a doctor who works in holistic preventive medicine, I could not ignore how this system depends on a steady influx of sick patients. To me, it begs the question, what if we shifted our focus to prevention and wellness? What if cancer were curable or preventable through wide-reaching health measures? Would clinics like this one exist as they do today? The compassion of the staff was truly undeniable, but the reality remains their livelihoods and their entire healthcare economy depend on people being sick. This isn't a failure of individuals, but of a system that incentivizes treatment for illness rather than true health. It's a system built around sick care on an industrial scale. So let's talk about some of the factors driving this crisis. First, I think it's the standard American diet. This diet is filled with processed foods and sugary drinks, additives that contribute to chronic inflammation, metabolic dysfunction, and nutrient deficiencies. Ironically, our food system, intended to nourish us, actively contributes to disease. Did you catch that? Actively contributes to disease. Then there's the pharmaceutical industry. Year after year, billions of dollars go towards convincing us, the American public, that every problem has a pill. Advertising persuades us to ask for prescriptions and quick fixes for symptoms without tackling the underlying health issues. But where's the support for dietary improvements, for holistic therapies, for lifestyle changes that make a real difference? With primary care doctors facing packed schedules, it's far easier for them to prescribe a medication than to have deep conversations about the health habits that could genuinely change lives. This has turned our primary care system into a reactive medicine machine, managing symptoms rather than root causes. Doctors are pressured to move quickly through appointments and rarely have time to promote the changes that could improve the quality of life. As a result, we have a revolving door of patients instead of a culture of wellness. Imagine an alternative. If our healthcare system prioritized wellness, directed resources towards education on healthy living, and encouraged prevention. Imagine that. If doctors were incentivized to prevent illness as much as they are to treat it with pills, we would see fewer crowded waiting rooms and more people truly thriving. It's frustrating for me to know that even as the United States spends more money per person on healthcare than any other country, our life expectancy remains low compared to other high-income nations. We're paying a premium for a healthcare system that isn't making us healthier. We've accepted this high cost without demanding a shift towards wellness. So reflecting on all of this as I sat beside my husband in that waiting room, I'm reminded of why I chose a career in preventive medicine. Every day I guide my patients to take control of their health by addressing the underlying causes of disease, encouraging lifestyle changes, adopting truly nourishing diets, and reducing dependence on medication. My mission is to help people live fully, healthily, and freely without being trapped in the cycle of sick care. In the end, true health isn't found in a waiting room or a prescription bottle. It's found in the choices we make each day, in the food we eat, in the habits we form. Until we make a national shift towards prevention, we'll continue to see too many families, too many lives altered by disease that in many cases could have been prevented. Thank you for listening to Your Path to Wellness. I am Dr. Marian Constantinidis. I'm your trail guide on this pathway. I hope today's conversation sparks some thoughts about what real healthcare could look like in America. If you found this episode insightful, please consider sharing it, and let's continue the conversation about what it takes to create a system that truly prioritizes health over sickness. Until next time, take care of yourselves, and remember, real health begins with each of us.